This is a training video that will teach you how to classify wound injuries and document them correctly in the medical record. The first step to classifying a wound injury correctly is to understand that there are two different types of wound severity classification systems that are required for the medical record documentation. I will begin by explaining the two classification groups by referring to the NE1 wound assessment tool for easy teaching reference. Start by referring to the yellow shaded box on the upper left arm of the L-shaped ruler. Here you will find the two wound classification titles named Pressure Ulcers and Other Types of Wounds. I will start first with the classification group called Pressure Ulcer. Next, follow the bottom arrow from left to right across the tool to read all 8 possible pressure ulcer classification conditions in this group, from closed or least severe through unstageable, most severe. The second classification group is called Other Types of Wound Injuries. This large group includes all wound injuries that are not pressure ulcer related as defined by the National Pressure Ulcer Advisory Panel, or NPUAP. The other wound injury group has 4 possible severity classifications, and they are going from left to right, closed, superficial, partial thickness, and the most severe, full thickness. Referring specifically to the NE1 tool, directly below each severity wound injury type, there are wound image examples. There are 13 specific wound image types going from left to right, with their supporting classification details that correspond with the written characteristic details on the right arm of the L-shaped tool. For example, one differential characteristic between a pre-stage 1 and a stage 1 is that one blanches pre-stage 1 and one does not, stage 1. To be a good wound assessor, I recommend that you study each wound image and know each written characteristic corresponding to the right arm. This will help you break the bad habit of guessing. Now that you understand that there are 2 types of wound classification groups, pressure ulcer and other, we can move on to the 4-step proven methodology that will assist every clinician with correct wound injury classification. This new methodology follows a simple acronym called HATT, and these letters stand for history, anatomy, tissue type, specifically worst tissue type, and touch view details. Every time you assess a wound, put your hat on and learn a great new habit. Step 1. H. H stands for history, or what caused the wound injury. By knowing the history of the wound, the correct classification group can be assigned. The NPUAP has defined criteria to meet pressure ulcer group guidelines for staging assignment. If the history or cause of the wound injury is not due to a pressure ulcer or pressure injury, then the other type of wound injury classification is applied for superficial, partial thickness, or full thickness. Step 2, A, stands for anatomy, or location of the wound injury on the body part. Step 3, T. T stands for tissue type, but more specifically worst tissue type. Use the NE1 tool to determine the worst tissue type. Note, even if a small portion of the wound is worst colored tissue type, the whole wound will be scored or classified based on this worst tissue type. In the example shown, the small dark purple area would be the worst tissue type. Step 4, the final T in the HATT methodology is touch view details. These are important wound characteristics that further differentiate the specific classification levels. There are certain specific details to view and document from the wound photo, but not all characteristics can be found from a wound photo alone. A bedside assessment needs to be performed and combined with the wound photo details. These important characteristic findings include the blanch test for capillary refill, temperature, and different levels of firmness and softness. Best practice is to combine your bedside assessment with the wound photo assessment using a proven standardized method. Now let's practice correct wound classification using the new HATT methodology and create a good assessment habit. Now let's play Name That Wound. Case study number 1. Remember to use the HATT habit. History, or what caused the wound. This patient suffered a spinal cord injury 10 years ago and is a quadriplegic and dependent to turn in bed. Group classification is pressure ulcer due to poor mobility. Anatomy, sacral area. Tissue type, specifically worst tissue type, is black eschar. Touch view details, exposed bone. Answer, pressure ulcer stage 4. Case study number 2. History, poor mobility after lying on an ER gurney for more than 32 hours. Anatomy, sacral wound. Tissue type, worst tissue type, purple. Touch view details, boggy and non-blanchable. Answer, pressure ulcer, suspected deep tissue injury. Case study number 3. History, diabetic diagnosis. Anatomy, right bottom of the foot, plantar surface. Tissue type, worst tissue type, bumpy red granulation. Touch view details, bumpy red, non-intact. Answer, other, full thickness. Congratulations! You have taken the first step toward learning a good wound assessment habit. From now on, when you assess a wound injury, put your HATT habit on. Yes, anyone can do it.